Good morning. That was quite a morning. We had a little controversy. Out here in the West, we tell people to keep their guns in the lobby. I think you should keep your catheters in the lobby. Okay? So what we're going to talk about today, first of all, Rick Jacoby, and I'm from here, and I have probably the oldest living person that knew Dr. Dietrich. I knew him at least 50 years ago. He invited me actually to this conference, the TED conference at that time, in 2010. And I introduced the triple nerve release concept to the Vascular Society. And that was taught to me by Dr. John at Johns Hopkins with Dr. Lee Dellon. So the viewpoint from vascular is looking inside the vessel. The viewpoint from peripheral nerve surgery is looking outside the tunnel, compression. Both apply, and we're going to talk about how I got to this subject we're going to talk about today, and that is stem cells. So I'm going to go through this rapidly. Only have 8 minutes here to talk about it. So Dr. Dellon taught me the act of decompression nerves throughout the lower extremity for diabetic polyneuropathy. It's glycation that causes this problem, and that is sugar. It's not cholesterol. Now, I hear a lot of money talk today about the cost of things. Statin drugs are $1 trillion drug. Only live 4 days longer if you take it than if you don't, for $1 trillion. So keep that in mind. So catheter or no catheters. So after training with Dellon, I actually said to Dellon, I think there's more to your theory. And I found Dr. Cook at Stanford, and I worked with him for about 5 or 6 years on the biochemistry of nerves. Now, he's a cardiologist by training, and he has a PhD in vascular biology, and he taught me this pathway, the asymmetric dimethylarginine pathway, which is a endogenous inhibitor of the nitric oxide pathway, and this was back in 2004. That interested me quite a bit. We worked on that. I based my first book on his work at Stanford, and that led me... Cellulose madres, and this led me to stem cells. Interestingly enough, Dr. Reardon, who is the biggest voice in this stem cell world, is from Scottsdale. And he left here 25 years ago from a political point of view because he couldn't do that here, developed this, went to Panama, I visited him there. That's the Spanish word for stem cells, which are not stem cells, by the way. It's a vascular issue. They're periocytes, and we'll get into this. So on this slide, you can see those little cells there that they call stem cells. They're really periocytes, by the way. But Arnold Kaplan, who named it mesenchymal stem cells years ago, realized what he was seeing was not really a stem cell. And he renamed that in 2017 to an MSC, medicinal signaling cell. But you can see on that red slide there, that tube, the periocyte, that's the progenitor cell. That is what is doing the heavy lifting in vascular biology. So this paper that I'm going to present to you in real quick fashion here, this is a exosome or microvessel, one of those microvessels, an exosome, and they're very small nanoparticles, but they can carry cargo, as they like to say in that biology. So you can put anything in there you wanted. So we're going to talk about critical leg ischemia. And you know the statistics for this. What do you do when you've done all the techniques, atherectomies, which I think you guys do, I heard today, and they fail, which they do at some point, and you're stuck with what do you do? So we're going to talk about NBank as an option to these patients who have ischemic. In a mouse model, this has not been done on a human being yet, but what is NBank? N-bank, to think of it simply, is there, and they use terms like this, decorating a nanovessel like an exosome, and in this particular case, nitric oxide. And what that does is changes the outcomes of this ischemic disease. It's a game changer, absolute game changer. So periocytes or endothelial cells alone do not construct viable blood vessels. In other words, they leak. And Dr. Cook actually was doing VEGF injections in the leg 30 years ago, before I met him up at Stanford. But this technique adds the nitric oxide to the nanoparticle, the exosomes. So the addition of nitric oxide is magic. So it makes that endothelial tube that was created, that was non-functional, it adds the mural cells, which are the vascular smooth muscle, plus the periocyte, and the nerve itself shares the basement membrane with both the artery and the nerve. And here's the crazy point. 100% of the ligated mice, when they ligated these mice at the femoral artery completely, they added this periocyte combination of nitric oxide, which produced endothelial nitric oxide synthase, and allowed the periocyte recruitment. And with that recruitment, that made that vessel, in that red vessel there, with that periocyte on top, a viable, growing tissue. And that tissue was led by different growth factors like VEGF and platelet-derived growth factors, and it caused all the mice in the study to be 100% revascularized. And they had nerve conduction as well. These mice had gangrene, totally gangrene, 14 days, totally revascularized. So they didn't have to go through the old artery. Didn't have to be atherectomized, because this new vessel went around that. This is a game changer. So I beat by 22 seconds. I'm proud of it.
Amazing.
Thank you.
Was there angiographic evidence of new vascularization?
Pardon me?
Angiographic evidence?
Yes, so it is. Yeah, the paper is Ling Gao wrote the original paper, and a very detailed paper. It would take hours to go through in detail, but she did a marvelous job. Yeah.
Amazing.
Amazing.
Isn't it amazing?
There is.
Yeah.
So we're going to be looking for human trial, and I think this will give you a tool to back up the work that you're doing. And I think, because I work with all the vascular people, whether they're in the hospital or they're out of the hospital, I tend to think the ones who have the vascular outpatient facilities, they're just better doctors. They are. And what I mean by that, Dr. Ramaiah, he had that foresight. He's the one that I worked with Dr. Dietrich 15 years ago, and he gave me that confidence to go forward. And I appreciate everything Dr. Ramaiah has done for me. Thank you.